How do you think supporting Nevada's public health infrastructure will create a brighter future for the next generation?
Public health is all about prevention. Supporting public health today will ensure that the next generations can enjoy a future with a thriving public health infrastructure, healthy communities, prevention of communicable diseases, protection against environmental health hazards, and preparedness for emergencies.
Tell me what makes you passionate about public health.
So what makes me passionate about public health is you get to focus on the community as a whole and make specific interventions based on the community's needs.
What role does public health play in your everyday life?
I think that a lot of people don't really understand what public health is, but for me in my everyday life, public health is the ability to brush my teeth or wash my hands without having to worry about the water being contaminated. It's also the ability to use sidewalks or cross the street at crosswalks without having to worry about cars hitting you. It's also, I think, the ability to go to the grocery store and have access to healthy food because we have the privilege of not living in a food desert.
Tell me what makes you passionate about public health.
I'm passionate because my partner has an autoimmune disease. She has celiac disease. And so being aware of public health concerns and community health safety is really important to me in making sure my partner stays safe and healthy and we can live a comfortable life that way.
What are the misconceptions about public health that you want to clarify?
One misconception that I would love to clarify about public health is that researchers, we just change our minds all the time. What I would love people to understand is that through research, we have a topic and that we investigate, but from our results are constantly evolving and changing as we continue to ask more questions. So it takes time and it takes a lot of studies together to continue to perpetuate what we know about a subject. So our results are constantly changing, nothing stays stagnant, and that's something I would love for people to better understand and for misconception to be resolved.
Tell me how kinesiology and public health are connected.
Well, kinesiology and public health will always be connected, and that's because everybody in the world has a body, and it's amazing how much that keeping your body active, even if it's just a little bit every day, can help prevent diseases.
Mr. President, in your opinion, how does public health impact the economic health of Nevada?
Better health fuels economic growth by enlarging the labor force and increasing productivity. And I believe that public health and education are two of the foundational building blocks for a really successful and productive society. So having trained public health practitioners in the field, taking preventative measures to limit the spread of diseases, environmental disasters, and providing mental health services is a direct reinvestment in our state.
What role does public health play in your life?
So public health has played a major role in my daily life since I was diagnosed with type 1 diabetes at the age of 4. The policies directly impact my quality of health, and I want to be an advocate for those who also have diabetes to have affordable, quality medicine and health care.
From a public health perspective, how does kinesiology support longevity and healthier communities?
Kinesiology really embodies what we need to do to be active to have longevity. The more active we are, we know the healthier you are, the lower risk you have for diseases, the lower risk you have for some kind of disability related to your inability to work or walk or sit or stand. All of those are related to kinesiology. An active body is a healthy body. And in kinesiology, we want to use activity, exercise, anything that gets people moving to prevent disease. And prevention of disease is the overarching theme of public health.
Tell me what makes you passionate about public health.
So what makes me passionate about public health is the fact that we can use public health to educate our communities and teach them how they can live a healthy lifestyle so they can develop a brighter future.
How does public health impact our community?
I think it definitely impacts with the education aspect of it. So getting out into the community and educating them on what's going on. It helps us be more preventative versus being reactive to incidents and issues that are happening. So staying educated, talking to people in the community can help with all that and keeps everybody safe.
What makes you passionate about public health?
I really like the aspect that it tries to work with the community and focus on like the bigger picture rather than like pinpoint pinpointing. I know that pinpointing is really important, but I think that kind of you can stop a systemic problem before it becomes a selective individual problem. I think that that's really important.
In what ways does public health influence our daily lives?
Public health is everywhere, in speed limits, harm reduction, safety, and even the nutrition labels at the grocery store.
What's a common misconception about public health you'd like to correct?
So, public health is often misconceived as healthcare. However, public health is a much more diverse interdisciplinary field that focuses on protecting the health of whole communities through social determinants such as access to care, housing, food access, financial stability, and so much more.
Tell me how kinesiology and public health are connected.
While promoting more movement and better movement increases quality of life, reduces risk of injury and illness, and improves health outcomes.
What role does public health play in everyday life?
Public health is everywhere. It's traffic safety, air quality, vaccines. It just is part of everyday life.
Tell me how your public health degree has impacted your career.
So I work for the Washoe County Health District in environmental health. It's helped me a lot with my communication. I'm a regulator, and so I deal with operators and the public on a daily basis. I've learned a lot about just the foundations of public health, like I said, communication skills, the importance of the regulatory role in environmental health. It's been priceless, really, for my career.
As former governor and current president of the university, what do you think public health needs to address in Nevada?
Well, it's no secret that the state of Nevada is one of the fastest growing states in the country. And to best support this new growth, we need to ensure that we have the proper infrastructure in place, such as access to rural health care, limiting the spread of diseases, creating and maintaining physical and digital accessibility standards, and even disaster preparedness. Nevada needs public health to research, plan ahead, and prevent harm from reaching